Good evening, everybody. This is Anand here from Clinsav team, and we shall be starting in the next 2 minutes. Okay, we are going to start this webinar now. So, good evening, everyone, and welcome to the Gyaan Vardhini session number 16. I'm Anand from Clinsav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I'm going to give a brief introduction of Clinsav. I'll be sharing an overview of the amazing Clinsav app that we have developed over the last 5+ years. Clinsav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. Clinsav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, and doing follow-ups with patients for any outstanding dues. Clinsav also sends automated appointment reminders a day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall start with our today's webinar. Our today's webinar topic is Discovering Iridology as a Deepening of Netra Pariksha. Our distinguished speaker for today is Dr. Sathyavathi S. Dr. Sathyavathi is going to present this webinar today from UK. She's based out of UK and she'll be doing that from there. So good afternoon, Dr. Sathyavathi.
Thank you. Good afternoon.
Dr. Sathyavathi S is an Ayurveda Acharya with a postgraduate diploma in medical law and ethics and certification in Iridology and Western herbal medicine. She has 8+ years of experience and she has been under the guardianship of eminent gurus like late Vaidya Ratnam, Dr. K.S. Vishwanatha Sarma, late Dr. Narayan Patwardhan, Dr. Devchand Gala, and Alan Payne. She is currently living and sharing the Ayurvedic wisdom in the United Kingdom. Her approach towards health leverages using Dinacharya and Rutucharya, both for treatment and prevention, emphasizing on the Swasthavrutta side of Ayurveda. She regularly conducts workshops and courses to educate people about using the principles of Ayurveda in everyday life. She has also been hosting several retreats to enable people to experience the miracles of a life following the Ayurvedic principles. She has been a firm believer and propagator of the science Ayurveda, and it is her primary objective to create mass awareness and carry this wisdom far and wide. Dr. Sathyavathi, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Sathyavathi S for today's session. Dear ma'am, you can start with your session now.
Thank you so much, Anand. Thank you, sir. Thank you for introducing. And hello, everyone. Good evening. I wanted to host this webinar. I wanted to introduce this to people because it's not something that everybody is aware of. A lot of people don't even know much about this. And I have titled this as a lost perspective for Netra Pariksha. And I would like to get into the detail of why I want to call it a lost perspective in a little bit. But before I do any beginning, it is always going to be inappropriate if I don't pay my respects to all my gurus. So at the beginning, I would like to thank all of my gurus and my mentors who have been my support, my pillars, and without whom I would have not been able to understand Ayurveda in its right form. And in particular, today I would like to also mention about Alan Payne, who's a master iridologist and master herbalist who is based in the United Kingdom. He's in his 80s and he's got 45 plus years experience practicing iridology. Um, I have had the opportunity or blessing to learn this from him. And what I'm going to present and whatever I've learned is a little bit of what I have learned over the years that I've learned from him. Now we have all known about Ashtavida Pariksha, and we tend to even memorize saying Nadi Malamutra Jivha Shabda Spashadrakakruti. But to what extent are we able to use each of these is something that I would like to, explore to a greater depth. When we think about Nadi, we could go to the basis of just looking at the pulse and seeing there is Vata, Pitta, Kapha. Or there are expert Nadi practitioners who can look at the Nadi and say the future of a person to the past of a person. And this Nadi Shastra is a parallel science that is existent along with Ayurveda. It adds as an attachment. And there is a Shastra, there are literatures, there are scripts that are available for Nadi Shastra. Similarly, when we look at Mala, Mutra, we have so much information that we can acquire, we can learn from, we can understand about the person that is in front of us. A lot of people have been teaching tongueology these days, and it is becoming more common for people to understand and explore the tongue. Similarly, we can use speech to a greater depth. Touch, we can understand and assess the person more than just a palpation of the belly or the joints. Understanding through touch, you can understand a greater detail of what's happening physically, anatomically in the person. Brick, we often tend to look at the eyes, look at the color, the shape, look at the size, and then I understand if it is Vata, Pitta, Kapha, etc. And that has been our primary way of understanding Drik as a way of understanding examination, assessment, and Akruti as well. When we look at a person, we often don't tend to understand the detail to which we can go in. We can look at a person, look at the posture, and understand a lot more about the person and their imbalances. There is apparently a practitioner who can understand problems within an individual through the gait. So the depth to which we can enter is absolutely unimaginable. In a similar fashion, I believe that Netra or Druk was possibly a parallel examination where we had a lot of information or literature that was available and is possibly lost. And our ancestors, our Vaidyas, were able to use eyes as a deep level of examination, but somehow it has lost its way and we are not able to access it in the way it was available. Now, when we come to Netra Pariksha, as I earlier mentioned, we can understand the general anatomical understanding, what is the size, shape, color, etc., and understand what's happening. But apart from doing that, we can also use iridology. Now, iridology is such a fascinating subject because they say that the world is entirely present within our eyes, and it is such a true statement that I discovered only after learning iridology. When we use the iris map, when we use the understanding of what the iris are representing, we can understand how much we can explore, how much we can understand while looking at the iris of a person. Now, iridology is used as an assessment. We do not use iridology as a diagnosis, as often a lot of people say. Iridology can be used as diagnosis. Iridology can be used as a tool to assess the person, assess the predisposition of an individual, rather than say this is acutely happening right now. There are some signs that we can use that are available. Otherwise, it is often going to give us a static image. And along with iridology, if we bring in sclerology, sclerology is understanding the white parts of the eyes and then being able to examine the signs that are present. And interestingly, sclerology, we can find that there are signs available that tend to change quite easily. So we can observe, along with the tools that are available in sclerology, the pointers that are available, and we can use the maps and identify what is the sclera trying to indicate within the iris. Now, with the use of iridology and sclerology as a combination to be used as Netra Pariksha, what is the benefit? Why do we need to use it? Now, if you're able to look at a person's eyes and say, have you had a problem when you were about 5 years old? Do you tend to have digestive problems, particularly on the right upper quadrant of your belly? And the person completely looks at you shocked, saying, how do you even know something like that? How can you even have any clue that this is exactly where I have got some issues? And instantly that person has, come to your side. You have won their trust. And that is a very important factor when you are considering your consultation. When you're consulting, you really need to gain the trust of an individual so that they're able to understand and appreciate your prescription. So when we use iridology and sclerology, the other beautiful benefit is that it's a static image, which means everybody can learn it and start to use it. Nadi is a very, very dynamic Shastra where you have to understand how it changes. But when you use iridology, it is like an X-ray. It's never going to change. It's almost going to look the same. Now let's see what do the iris reveal? I will give an introduction here. So I will try to explain all the things that are possible. Now, the iris reveals the story so far. This is an interesting way of putting this across. These are all Alan's words. He says that when you're meeting a person, when you look into their iris, you're able to see the entire life until this point in time. You can understand everything that they've been through. Interestingly, you can also see the things that they've inherited and their families are going through. So it gives you the picture of the story of whatever the person has experienced so far. It gives you the potential for an imbalance. Now, it tells us that this person can have a possibility of an imbalance in the liver. This person can have an imbalance in the kidney. This person can have weak nervous system. So it gives us a potential for what kinds of imbalance this person can have. They can have an imbalance in producing too much mucus. They can have an imbalance in not being able to clear their waste. So we can understand that by looking at the iris. Now, constitution is very differently understood in Ayurveda. In Ayurvedic perspectives, rather, we see the constitution as Prakriti, Vata, Pitta, Kapha, etc. But then iridology notes gives us a perspective of a different kind of a constitution. Now, when I try to understand iridology, my brain always is trying to understand and draw parallels between iridology and Ayurveda. Now, what I discovered is there is a possible connection between these constitutions and the Dhatu Prakriti, where we are understanding about the dhatus within the person and the Prakriti that is associated with that. Now, there are different kinds of assessing the individual and understanding the constitution. Now, physical and emotional inherited strengths. So we can identify the strengths that naturally this person has, as well as limitations that the person has naturally inherited. And the point to be noted here is inherited, where this person inherits specific traits from the father, from the mother. The status of the nervous system. We can identify how strong their nervous system functions or how easily susceptible their nervous system is to stimuli. We can understand the functioning of every single individual organ within the body, as well as understanding the toxicity potential. Now, I will try to deepen this a little bit more and try to explain what is the scope when you're looking at the iris. Now, what is the point of me knowing the story so far? Well, I can understand the whole history of the individual. You look at a person, and then if you're able to say, what happened as a story, when you were 20, and you can ask and prod the questions, and then say what is it what the story is, and they come along and tell you what their history could be. So we are able to join the dots, not just from what the person has told us, but then we're able to go deeper and identify the exact points where we want to understand the history from. And we, of course, know how important understanding the history is to be giving a precise diagnosis and treatment. Now, potential for an imbalance. Ayurveda is a predominantly preventive science. Unfortunately, we do not tend to get to practice Ayurveda as a preventive science. In the West, in the UK, it certainly is more possible, but then when you're looking at the iris, now opens the doorway of opening the perspective and sharing the point, saying Ayurveda is also a preventive science. So you can give the person the knowledge and give them the guidance. So this is opening the doorway for teaching people dinacharya. This is opening the doorway for teaching people the lifestyle that they need to do to prevent imbalances. Now, when you understand the inherited constitution, when you understand the person coming in front of you, you can see, okay, this person is somebody who is going to follow every little thing that I'm going to prescribe. Then you know then you know how to prescribe, how to talk to this person. But if you know this person is going to be really lethargic and they're not going to even listen to you, then you know how to approach as well. And when you understand the constitution, if you know this person is going to have a weak digestive system, then you automatically know how to put a prescription in place. So this helps us design our approach as well as plan a prescription. Like I mentioned earlier, understanding the inherited strength can help you educate your patient and offer a positive light to the consultation. Now, this is something that is not at all happening, not within my understanding that happens, where a patient comes into your clinic and you're saying, oh my God, that's wonderful. You've got a very strong nervous system. And this is never an opportunity normally, because we are trained to look at the doshas of an individual. We're trained to look at the imbalances of a person. But then if you can start the consultation on a positive light and say, here, this is a positive thing that is there, and you can use this strength to help your weaknesses. And it gives us a positive way to approach the whole consultation we have with the patient. Again, we can understand the limitation and educate the patient, and give them the scope for prevention of imbalances, which definitely reduces the workload of all the doctor faculties. Now, when we understand the status of the nervous system, we can understand the status of the mind and the body. And understanding the mind is something that is not very easy to assess. We think of Manasik Chikitsa and we have very little tools or very limited tools of understanding what this mental status of this individual is. There are a bunch of assessments, questionnaire, but nothing much more than that. With the use of the iris, you can understand exactly how specific your mental Manasik Chikitsa can be. Now, when we understand the organ functioning, we can understand the deeper and precise samprapti. To share a story of Alan, his cases, he had this lady who came to him and said, I have got a lot of hormonal imbalances. Can you give me a herbal prescription for hormone balancing? And he went ahead and he looked into her eyes. And he found that this lady did not have any predisposition for hormonal problems, but instead she had a predisposition for liver imbalances. And interestingly, the hormones are metabolized within the liver. And when this was identified, he tried to work and help the liver of this individual. And without any surprise, the person's hormonal problems vanished. Now, how amazing is it if you can identify looking at the iris of an individual and find the exact samprapti, where did the problem originate, how has it progressed, and where is the person right now? So you can identify this by looking at the iris of an individual. Now, toxicity potential, in the sense how easily this person holds on to things or eliminates waste, which tells us that naturally how good is the agni of the individual. Naturally, how easily they tend to store ama in the body. And if you know that they have an inherited possibility of having a lot of ama, then we can teach them or guide them understanding how to have their diet that is going to prevent these problems. Often people come, we give them a diet, we give them a prescription, they go back and they feel better. They come back and they come back with the same problem or different kind of a problem, but their problems are not ending. And when you educate a person saying that this is something that you need to know, then it prevents more problems from arising in the future. Some more things that the iris can reveal. We have tendency for various conditions. Now we can understand if this person has tendencies for arthritis, diabetes, we've got tendencies for inflammation. This can be understood easily looking at the iris. Statuses of the tissues and tendencies for blockages. The gut functioning, which is a primary thing within Ayurvedic perspective. Energy and stamina, behavior patterns, traumas the person faced. This is something interesting. I'll come to it in a second. Karmic potential, genetics and potential for epigenetics. And now what is the scope of using this information? Again, tendencies, preventive approach. You can look at the person's eyes and say, here, you've got an inheritance. Is your father's side family having a lot of diabetes? And that can be very precisely understood by looking at the person's eyes. And then you can prevent this by giving them Swasthavrutta, preventive treatments, so preventive prescriptions. Dhatu Sara Saratva, which I previously mentioned, but this can also be going into deeper stages of understanding if there is potential of Rakta Vikruti, or is this a person going to need more support in these areas? Now, when we understand the gut functioning, we can understand how the Koshta of this individual is and how the Agni works of this individual. We can also precisely understand how good the Bala of this individual is. This is the Prakrut Bala, not the current status of the Bala. If this person will be able to understand and digest things that you're going to be prescribing them. The behavior patterns, there is a possibility of using this information to give life and lifestyle coaching. There have been instances where people have come to me and asked me guidance about what is the right career for this individual. And including the concept of the doshas as well as the iris, there has been such a beautiful potential to give this guidance where I'm able to give all that information to. Now, something that I don't know many practitioners or many iridologists for that matter would even know about this. Now we can look into the iris of an individual and understand the different traumas that the person might have gone through. We might not be able to know exactly what, but we might be able to say, okay, this is approximately what you've been through. And you can look at that and then possibly say, okay, is there a lot of grief that you've been through? Then that can you can use that information and accordingly have a prescription for your manasik chikitsa. And this becomes very important because with the mind is the root cause for a majority of our problems, and we are all well aware of that. And when we think of mind as as the root cause, instead of giving a generic prescription, go to meditation, go do some chanting, we can have specific instructions that we can give, understanding the specific problems that the person has. Now, karmic potential is again something that is not something that many iridologists practice. And this has been incredible because almost 100% of the times when I've been able to look at the iris of an individual, when a person is interested in something like this, I would ask them, I would give them a reading of what it says. And they would be precisely saying, I would say, is there a problem with you finding trust? You do not find trust easy in this. You know, you've had many instances and people would be like, that's exactly what it is. And I have been trying to work on that many times. And it has been also said that certain signs that we see in the iris can talk about how we have karmic things that we are carrying into this lifetime, and what could be the life lesson that we have to learn within this lifetime. It's quite fascinating how people could come up with all of these readings and understanding and put this all into notes. I feel very blessed to be able to know all this. And similarly, if I can understand the genetic inheritance, saying this is from the father's side, this is from the mother's side, we can definitely use Ayurveda as a potential for epigenetics, because Ayurveda is definitely potential. It is very powerful in being able to use it like that. So it opens up the doors for using it as epigenetics. I have put a question mark here because this is all just my introductory understanding within this science. There could be a lot more that we can discover. Now, to summarize, I would say that when we use iridology, we are actually able to practically use Ayurveda, which is treat the person and not the illness. I will try to make this not very boring. I will try to give small snippets and small stories of what iridology, how iridology came up, and I'll then move forward. Now, there have been literature, people have gone around, archaeologists have excavated, and they found that in, I might say this very wrong, in the tomb of Tumonkakon, I don't know, some Egyptian king, they found that there was a silver plate with the exact detailed marking of the iris. And this was from thousands of years ago. There has been literature mention about the Greeks, Indians, Chinese, Brahmins. I put a question mark because I have not been able to find the literature for it, but there is a mention about that. So a lot of people with throughout history have been using iridology in different manner. And that's again why I feel it is a lost perspective. Um, then after being lost for a long time, what brought our current day iridology, I'm sorry, is this European person called as Ignaz von Pexley. And this particular individual, he was a surgeon in a Hungarian medical college. And what he did was he was looking at the iris of an individual. He was performing surgeries. He was making notes of the iris before and after the surgery. And he came up with this beautiful book. And this beautiful book became the starting of the modern day iridology, what we have. And many practitioners like that, many practitioners like Dr. Edward Rahn, who did autopsy correlations. He looked at the dead bodies of individuals and looked at their problems in the body. He did that while doing surgeries on live people and identifying these signs. So these were all doctors that sat around and thought there's something more to the iris than what we can realize. Then came Dr. Bernard Jensen, an American. He he has been a big contributor to iridology today because a lot of the charts, a lot of the notes that are available have been this individual here is Dr. Bernard Jensen, by the way. So he has been the torch. He's done a lot of groundwork for us to make use of all of this information. He's worked on apparently 350,000 plus patients during his lifetime, and a career which spanned nearly 60 plus years. And then came Harry Wolf, Bill Caradona, who have also done very significant work. And I have just mentioned different continents and different practitioners that have been working. There have been many other practitioners that have been adding to this. And a summary of all of this means we've got at least some part of the lost literature again, and we're able to use this in our practice. Now, when I discovered iridology and when I wanted to study it, I of course wanted to draw parallels. So I wanted to understand if is there anything that is there within the Ayurvedic understanding that I can find which makes sense as to why would the iris have all of this information. I'm not sure I still have the answer, but I wanted to just present some points that I felt might be relevant. Now, within this, it said that the Satvika Hankara or the Vaikarika Hankara, it helps in formation of all the Indriyas. Uh, the other point that I found was that Netra is often known as the Prasada Bhag of Majja Dhatu. Or here, often as people tend to correlate, Majja can be the brain that we're referring to, the nervous system. And Majja is also referred to as Mahanetra. It is possible that our Netra are it's just a reflection of the Mahanetra that we already have. It's a theory. I just want to open this door for people to think about it. Now, this is another point that I found might be quite relevant, which is Sarva Bhuta Guna Udbhavam. It does not say that particular Mahabhuta. It says all the Mahabhutas and all their gunas have been instrumental in formation of the Netra, which can possibly explain why the eyes could have, or the iris could have, a representation of the entire being. Again, just some more references for the Majja and Netra correlation. Now, through the modern embryology, what did I These are some small points. What I found was the irises are derived from the neuroepithelium. So when I mean, I'm not trying to go into embryology to any depth here, but when we think about neuroepithelium, this is the one that becomes our nervous system. It it is often referred to as the stem cells of the central nervous system. And I found that it was interesting that the iris would develop from the exact same thing that becomes our nervous system. And within the anatomy, now this is not necessarily confirmed fact, but there are some literatures that say there are 28,000 nerves supplying the iris. And if that is true, then why are there so many nerves supplying just the iris? It certainly does have both sympathetic and parasympathetic nerves. It has, through the central nervous system, we've got the oculomotor nerve and the trigeminal nerve, which is all supplying the iris. It has 33 separate arteries that is the iris are being supplied, where the ophthalmic artery is referred to as the primary artery. And that is a generic description of what the iris is defined as. But my interest here was to understand what makes the iris so special. Now, this could be the part that I'm trying to introduce iridology to you and giving you some information as to how to use this. Now, when we look at the iris of an individual, we look for different parts within the iris and understand what is exactly happening. Um, these are images that you can easily find on the internet. You can find the anatomy in any textbook. But what I will want to describe here is certain areas that I am going to focus on today's talk. So when we look at this particular ring that is here, which is often referred to as the collarette, this is something that is of a great significance when we look at the iris of an individual. Now, identifying this particular thing helps us identify much more about what we're looking at within the iris. First, locating the autonomic, this is also referred to as the autonomic nerve breadth within iridology, that is. We first locate the autonomic nerve breadth, and I will show some sample irises, and then we can identify this together, identifying the collarette in the person. Now, every small sign where there is a gap, where there are more lines, where there are white areas, where there's a color, where there are pigments, that is. Here as well, you can see that these are blank areas or looking blank. They're definitely not blank. So every single point that we're looking at within an iris has a meaning, has an understanding, an interpretation. Now, to give an introduction to what will we need, what will we require, the tools for iridology. So when I'm practicing iridology, the basic elements that I require is called as a light loop. We need between 5x to 10x magnification, but it does not mean that if you have a bigger magnification, then you can understand better. Often you need a 5x magnification, which gives us the best input, and we use a higher power if you want to go focus into certain areas within the iris. Now, what I have found works very well. So this is how a loop looks, by the way. So what I found works very well for me is I place this right behind the camera of my phone. And when I look at the camera, so you can see that now your phone is able to zoom in much better. So you need a decent quality camera within your phone. This is not an expensive thing at all. It's a loop. Very easily available on internet. And you can combine these two and start your practice. It's as simple as that. Make sure that the light is not too bright. We don't want the light to be blinding the person, so it stops you from doing your interpretation, because even though you have an image, you might want to go back in and look at the iris of an individual to look at the live eye to understand what's happening. I do have a 7x magnification loop here, and I use this to go deeper and understand better. And I found that these two work perfectly enough, and I don't need anything more to look at the iris of an individual. The other thing that I do tend to sit with is maps. And I have gotten this off the internet. which means that you can easily look for this on the internet and find all of these maps. Now, this is a general picture of the iris map for the physical body. When you look at the top, so the iris is often divided as the clock. So 12 o'clock at the top, it goes clockwise, 6 o'clock at the bottom, and then we draw 12 quadrants and then understand where each organ, each part of the body is correlated. So here you can see the brain area. The top is often referred to as the brain area between 11 and 1. Then you've got the face. So the face would involve the nose, the ears, eyes, etc. On the left is, so here, sorry, the face. And on the left here is going to be the back of the neck. Come down here and you've got the lungs, the thorax. Similar, it's a mirror image on both the eyes. So you've got the lungs and the thorax. So you've got the heart, the lungs. On the opposite side, you've got the throat, upper back, etc. The scapula, etc. come around here. So it's the same reflection. And then we come down here and here comes the liver. So you're coming into the upper abdomen around this area. And then you come into the lower back here. And then here comes the pelvis, urogenital area, the legs, etc. And this is a general understanding. And we earlier looked at the collarate. The collarate represents the intestines. So on the right eye, so if you separate the body as half, on the right eye, from the center, so you've got half of the transverse colon on the top, half of the transverse colon on the top, then you've got the ascending colon, and then the small intestine that is there on the right half of the body. And similarly on the left, you've got the other half of the transverse colon, the descending colon, the sigmoid colon, and then here is the rectum and anus. Now, when we look at a person and we look for signs, we see there's a sign that is there within this part of the colon. And then we can immediately understand, okay, there is something that is not right on the top of the ascending colon. Now, this is a very general picture. And this here is the detailed picture. I found it very fascinating that there could be so much precise information there. And the innermost area over here is the stomach. Again, how much to interpret this? This will, of course, need a complete course to understand that, but I wanted to introduce this to you. And if you were to look into the iris of an individual and look for these areas and find some signs that you're seeing there, you can often correlate saying there's something or the other that's not working all right. Or there is a potential for something not working all right. Not necessary that any sign that you look is a problem. There could be signs in an individual, but it may never manifest into a problem. So the person has to do things that can affect the body to make a problem manifest. Now, going into the other detailed side of the iris is emotional and behavioral map. Now, this map is by Mr. Jim Verghese, and I personally prefer the RAID methodology, and RAID methodology helps me understand and assess in a much different manner. But a lot of people tend to find there is a lot of relevance in this. So you can understand if there are signs in certain part of the iris, it is going to be correlated to different parts of, understanding this: will, heart, rebellion, nurturing, etc. Now, the other thing that we've got here is the iris zones. Now, this is an image that I got off the internet again by a website called ayurvedaposters.com. All credits to them. Now, iris is often also split into 7 zones from the extremity to the internal part. Now, when you're looking at from the extremity to the internal part, they have associated that with Rasarakta Mausameda Asti Majja Shukra. Although I don't necessarily agree to the whole of it, this is something that is available as a perspective. And as I say, this is some of this interpretation with an Ayurvedic perspective is going to be my interpretation rather than what is actually possibly true. So I wanted to share all possible perspectives here. So The external part being rasa, to internal part being shukra, and then within the pupil, they look for prana, ojas, and tejas. And the seven rings that I have studied, the first ring is said to be the internal ring is said to be the stomach, which is often associated with digestion. The second ring is said to be intestine, which is absorption. The third ring is humoral, blood, lymph, glandular, and it's associated with transformation and distribution. The fourth is muscle utilization. Fifth, skeletal, ultimate utilization. Lymph, detoxification, and the last layer is skin, which is associated with elimination. And how much can we interpret here? Well, the sky's the limit. I also wanted to introduce the concept of time risk iridology. Now, very few practitioners tend to use this. Time risk iridology was primarily introduced as a concept by Dr. Daniel Loreto. He's an Italian ENT specialist, and he I mean, his work has been translated and is available, and a lot of other practitioners have started using this, but it is still a very small number. Now, this time risk iridology that we are looking at, this helps us understand the time clock of an individual. It's an extremely fascinating thing where you can see the age of a person in the iris and look at the specific eye, right or the left, and then understand, okay, there is a possibility that this person had an incredible trauma at whatever the age. Now, I'll share a story. I mean, I have had personal stories with the people that I meet, but this was a very interesting story of Alan's patient. And he had this lady that came to him. And this lady said, he looked into the eyes and he said, do you remember or have you known anything that happened at the age of 2? Because I see a very strong trauma sign that I'm seeing in your iris. And she said, I don't know, but I can ask my mother. And this lady was somewhere in the middle ages. So she comes back for a consultation again. And then she comes and says, Alan, I asked my mom and asked what could be the relevance to this. So her mom said, I don't know anything major, I don't know anything big. But what happened was one specific thing, we left you out in the garden in a crib, and you were wailing and you were yelling, you were shouting. And when I ran out, there was a cat crouched on top of you. Alan said, then maybe that might not be very relevant. And she said, no, Alan, this is very relevant. Because she says, until today, she was in her middle ages, as I said, she was in her 40s, 50s, maybe. And even until that age, she was getting a recurrent dream where she has this dream of a tiger pouncing on her. And she wakes up with that dream. So somewhere within her mind, within her body, this was present as a trauma. And how interesting that you're able to look at that in the iris of an individual and say, there is something that is there you're still holding on to. Now, associating this memory, associating the story, and giving them specific work means that they're able to resolve some parts of their health. So, time risk iridology, just an introduction here. All right, so here I wanted to start introducing some basic, or just one small section or segment of iris examinations and how we can start introducing it already. Um, Now, this is not an iris of a person that I have met. I found it off on internet, but I felt it was very nice to share just to make things easier to understand. Now, the first thing I'm going to look for is the autonomic nervous system, autonomic nerve breadth. So here is that, if you can follow the tracing of my pointer. So this is the ring. And what is interesting is that it's thick in certain areas, it is thin in certain areas, and it's almost disappearing in certain areas, like here. And when we're looking at the autonomic nervous system, or when we're looking at what I want to represent here is the koshta. So when I'm looking at this, I am trying to understand the colon and the intestine. So I look at this person's iris, and then I see that there are gaps, there are lapses, which means things don't flow very easily. So that is the first interpretation, a basic interpretation I'm making. So there is a lapse here particularly, and there is a lapse here. Now, what I can introduce here is, if you look at the autonomic nerve breadth, and as close as it is to the pupil, this is going to be called as a small collarette. Now, this small collarette means this person has small digestive capacity. They cannot digest very heavy, rich meals, which means their Agni is naturally not very strong. Um, what we refer it to as what dosha, I will leave it to you. Now, small collarette meaning small digestive capacity, and these people have to generally consume nourishing meals. They can, although uh, not necessarily need all of it. On the other hand, if this is spread far and wide, if the line goes very out, I'll show you in a bit what that might look like. If that goes far and out, what that means is this person has a large digestive capacity. These people will eat like a big portion, an extremely large portion. But what happens interestingly is these people do not tend to digest all of that food very well. They create a lot of waste, and they accumulate a lot of ama potential. That's what I'm referring to here. They accumulate a lot of things in their body, and they tend to use very little of the food that they're consuming. So the amount of nutrition that's available versus the amount of waste that's secreted, the mala that is secreted, is relatively large. So this is the simple understanding of looking at the collarette of an individual, the autonomic nerve breadth of an individual, and then understanding what's happening. Now, without knowing this individual, without understanding anything, I'm going to first give a generic picture of what I'm looking at here. Now, here I'm looking at this iris of an individual. I'm going to give only a couple of points. Um, I'm going to also look at the sclera of this individual. Now, what is happening in the sclera? What's drawing my attention? Alan always says this. When you look at the iris, there will be something that pulls your attention to it, and try to understand what is happening there. So what is immediately drawing my attention is these small capillaries that are there around the iris. And this is often referred to as an allergy marker. So this person is actively undergoing an allergy, or is having a tendency for frequent allergies, frequent allergic responses, an increased element of kapha that is present in this iris. I am going to be looking for the color of the iris. Now, within Indian communities, it's not very easy to look at light colored iris. We will often have brown. I will show you some images of brown irises in a bit. And it is definitely possible to look at the irises with the right kind of instrument. So once you have one of these tools, you'll be able to understand that as well. So I understand here, I immediately look and I can see there is a tvak that this person is going through, and there is a severe rasadushti that this person is going through. Now, what tells me that? Now, this marking around the border, the periphery, it's often referred to as the Wolfram's nodules or as tophi. And when the color of these lines change, now in a brown colored eye, we will see that it goes yellow or lighter brown. Then we know that something is that the eyes are communicating something with us. So when we look for these color and this color starts to become more congested, it talks to us about more rasadushti that is happening. So this is in particular talking to us about rasadushti and this is the outermost circle that we're looking at. Now here is an example of another iris that we have. When we look at this iris, the first thing we're again going to look for is the autonomic nerve ring that we have here, the collarette. Once we have found the collarette, we are going to look at the shape of the collarette. The first thing I'm noticing is that the collarette is fairly circular, fairly balanced nervous system. Now, what I'm also noticing is that this person's autonomic, this collarette is irregular, like in the previous one. And we can again see that this nerve breadth is having certain dips, small points. All of these little points will become of importance, of significance. Now, when I look at this person's digestive system, I can see that things are fairly running normally. They're able to move all right, but because of the shape, because it's not circular, I can see that there might be a stagnation in the transverse colon. It might not be necessarily flowing very well. I'm just trying to get into the understanding of the colon and the intestine here. Now, this is an interesting one again. Here, we can almost not see the collarette. As I spoke earlier, the closer the collarette, the smaller the meals that these people can eat. And they do not need a large quantity of food. And if they do eat a large quantity of food, they're immediately going to have indigestion or digestive troubles. This particular person's collarette is nearly stuck at the pupil. And something that I also want to mention here is I have never seen the right iris and the left iris looking the same. There might be similarities, there might be some patterns we can notice, but they have very different irises. So here I'm noticing, and this person I'm going to notice and understand, okay, this person has a predisposition to have smaller digestive capacity. I'm trying to zoom in, but I'm scared of losing the image here. There are several other signs that we can notice. There are several other lines. Every single line that is there here, we can notice. Now, what I'm noticing here, which I can highlight possibly, is these many vertical lines that are sort of radiating from the center. Now, this gives me an indication that this person, as soon as the mind is affected, as soon as they're facing a stimuli, a problem in the universe, in their world, what happens is it goes straight into the digestive system, because as we discussed earlier, this is the colon, the small intestine. So their digestive system is the one that is getting all of the stress that they tend to experience. So the manas stimuli, the mental imbalances, they tend to go directly into the digestive system for this individual. So this is something that I am noticing in this person. Now, I mentioned earlier about the iris and spoke saying that the iris is a static image. It does not necessarily tend to change, but there are some signs that have a possibility or a potential for changing. When the color of the iris have changed, there is a potential for the color to get back better. Like I mentioned earlier in the images where the color has gone very creamy or yellowy or browny, those are possible, but these changes do not happen very quickly. The iris does not change very quickly. So you cannot expect that if a person has had a sign that indicates there's a cancer potential and they actually have had cancer and they have recovered from it, that the iris sign is going to go away. It does not necessarily happen like that. There might be occasional instances, but it does not always happen. So this is something that is important for us to know as well. When a patient asks us, we need to tell them that no, this does not necessarily go away. It tells the story so far. It tells everything that the person has experienced until now. Now, this is one case which I have personally experienced and understood some changes happening. Again, I'm not going to give credit to myself. I might say there might be a lighting trouble, a lighting change that is possible here. But something that I noticed, these irises, the images are about 3 months apart. So when I look at this particular iris, what I noticed, oh, okay, that's working. So what I'm noticing is that these white colored areas have gone very cream and yellow. When this person first arrived to me, he had an extremely poor Agni, really a lot of swelling around the body, and this person had not known hunger for years and years. Very young individual. And when this person had arrived to me, I looked at the iris and I could identify that, of course, there was a predisposition, but now it was very actively affecting a lot of his other systems. Again, when I'm looking at the autonomic nerve ring here, you can see how far and open and wide this is. As I mentioned earlier, a large collarette means this person is going to eat a large amount of food, but not necessarily process it and make more sarabhag. It's going to be more mala or kittabhag. Now, when I was looking at this iris of the individual, I did find that this person was eating a very large amount of food. So when I could ask this person and said, do you eat a large portion of food? The person, of course, immediately questions and says, how do you know this? And they eat a large amount of food, but they don't digest it all well. So I had to give a Agni correction, of course. Along with that, I gave them specific dietary instructions, not necessarily what to eat, but how to eat. And while giving that information and practicing the things, of course, a while later, I find that the color has slightly gone better. So here it is much darker yellow, brighter, darker yellow. Here the yellow color has started to come down. At this point, this person was definitely experiencing hunger about 2 times in a day, and their mala had improved, their koshta had improved, the swellings had come down. And although here as well, although the person was the symptomatically getting much better at this point in time, uh, this color has still not completely improved. So I do not have a 6 month picture yet, but then this is also something that is of significance to know. So this is the right iris, this is the left iris, and there is a slight change in this one as well. Now again, if something of interest is that you can see that the fibers here look quite different to the fibers here. Here you can see there are more gaps, more open areas, and here you can see there are more tighter fibers. So this also gave me an indication, and I asked this individual saying, is your father's side family extremely ambitious? Do they tend to be very passionate about things? They tend to grow well in the career in their careers. And is that happening more in the father's side? He says, yes, my grandfather was the CEO of a company and he rose in the career ladder quite quickly. Although on my mother's side, I said, might not be true for your mother's side. He said, yes, my mother's side is quite laid back. They are not necessarily so ambitious in a way. And again, this could be interpreted by looking at the iris. Now, another set of irises here. Again, look at the color changes. Here it looks a lot more brown, and here you can see a combination of brown and blue. This particular collarette again, here we can see, here this is the collarette. And over here, this is the collarette. Now this is fairly outward collarette, going larger, going halfway around the iris zone. And when we are looking at the collarette going out, we can understand again that this person has a really large digestive capacity, but not necessarily very good Agni. So this gives me an information of what this person is generally going through. There's a lot more that we can interpret based on these beautiful patterns that are there, but not necessarily all beautiful patterns mean beautiful things. So we can see a lot of things that are going on around this eyes, the shapes, the color, and every little thing can be interpreted as something that is happening within this individual. Now, this is again an image of the internet. I take no credit to this, but this is often very close to what we can see as irises of Asian origin. And here you can see how thick the lines are. You can almost not see the lines at all in the irises. The closer the iris, the more pitta the person is, the more pitta in not a general aspect, but pitta in the mind. They are very ambitious, hardworking, going and going, and they can keep going. Now, this particular the fibers that the fibers of the iris are so packed close to each other that you can understand. Interestingly, a lot of Asian population tends to have irises like that, and I found it quite interesting that a majority of the Asian population is very ambitious, extremely competitive, and they always want to do better than themselves or better than the others. And it was quite fascinating to discover how this could be correlated, and it is definitely possible that within the Asian population as well, we've got open more fibers visible, but a lot of us are like that. Well, I said us here, I include myself too. And here again, you can see the collarette. The collarette here is, you can see the thickness of the collarette. You can nicely find the thickness, but again, it has disappeared and become wispy here. I don't know here if it is the right iris or the left iris, so I'm not able to say which part of the colon because it's an image of the internet. But you can understand that here, generally, they've got a stronger colon, but here it has gotten weaker. Um, so far, I wanted to give you an introduction, a perspective of what iris can potentially provide us, how much we can assess and how much we can learn about the person in front of us, to the point that people can be. I have had people tell me that, Sashi, it's scary the amount of things that you know about me. So when I look at the iris of an individual, it definitely is an honor. You have to be quite respectful, and we have to understand that this is happening, as a privilege. So to first honor and be respectful of this opportunity is something that we have to practice. And once we then get into the person's iris with their permission, we then understand the whole world, because we of course are entering intimate boundaries. With this, I wanted to conclude my presentation today. Um, with my pranams to everybody, to my gurus, and with hope that this science can be used by many of us and can be spread across, and a lot of us can research further and possibly have a beautiful field that can be, a parallel science that can be added on to Ayurvedic teachings. I wanted to just quickly share the story of my discovery of iridology. I was in my teenage years, possibly, and I'd been to Chennai, and I met the Siddha doctor. And this Siddha doctor, he went into my eyes. I don't know what he saw, but he looked into my eyes and he came up with this precise list of all the things that I was, not having as a problem or a tendency for. And I didn't know at that point that I was going to study medicine. And later I came to the UK, and I had this privilege, I had this blessing to meet Alan Payne. And the first time I met him, he did a reading for me. And I told him that very day, Alan, whenever you're teaching and whenever you're running a course, I am your first student. I'm going to sign up. He had been teaching a lot, but he had taken a break. So I told him, please take me as your student. And I had this opportunity to learn from him. And as I have learned, I felt like there are greater depths. Every single class I was sitting, it felt like my mind was blown. And the more the mind was blown, I was feeling there could not be more. And every other class, I would feel there's more to discover. And I wanted to also, I spoke to Alan about, doing a talk today, and I told him if he would be willing to come to India if there was a lot of demand, of course, because it has to be financially viable for him. So I requested that if there is going to be a lot of interest, then we can bring him to India and possibly arrange a course on teaching iridology. And that is an option. So if people will be interested, and you're very welcome to express your interest, and we can possibly make something happen. So thank you, everyone.
Yeah, thanks a lot, Dr. Sathyavathi, for such an insightful and enriching presentation. Your expertise and knowledge have helped us with a deeper understanding on how the iridology uh, as a science that helps us with the netra pariksha can be helpful to all the doctors present here. So before we conclude, I would like to open the floor for any questions. Please feel free to raise your hand or type your question in the chat box, and Dr. Satyavati will address them. The Q&A shall be hosted and managed by Dr. Snehil Makwana.
Thank you, Anand. Amazing session, Satyavati.
Thank you.
Past, present, future, emotion, trauma, everything in just 2 eyes. Amazing. I remember when you checked my eyes and you said precisely that at the age of 29, I had something, and yes, it was true. And you have predicted that at 38, something will happen. So yes, it is scary.
But yes,
So
it
with
is
that,
something that is of a gray area as well. I have to mention this here. Even though we can know things like that, you have to be very careful whom you're going to tell that to. You do not want to terrorize a person that has come to your clinic and make them run away.
yes. So with that, we open the stage for question answer. If anyone has any queries, any doubts, Dr. Sathyavathi will answer to it. You can put it in the chat box or you can raise your hands. First query is how to recognize the trauma marks.
Trauma marks. Okay, I will be very honest here. I would rather suggest doing this as a proper study, a proper course, because theoretically you can find all of these books. All of this information is easily available. It's just this that when you are understanding theory and putting it into practice, it's very different. So when I studied iridology with Alan, what would happen was he would make us study with each other, practically look into other person's eyes. And when I'm looking at other person's eyes and I'm seeing, okay, there is a mark that I'm noticing here, then Alan would have to look at it and confirm, yes, that is the same thing that we are both looking at. And then I will be able to understand, yes, this is how I'm supposed to interpret. And more than that, these are all, split information. How to put that all together and understand what this person will look like, that needs understanding. So I would definitely say that, rather than there will be certain marks. Now, when I'm looking at the iris, there are going to be peaks, as we would call them. So there are going to be within the collarette, there would be areas that would be very strongly highlighted, where there would be gaps or where there would be very pointed areas, and that often would be indicating a trauma. But what kind of trauma, etc., we will have to learn deeper.
Okay. So next query is, can you share any notes of those lectures?
Well, there are many books available on the internet. You can definitely buy certain books that are there. I'm very happy to give the names of the books if you would like to read into it.
And the next one is the input from Dr. Ahmed Savani. Great presentation, Dr. Sathyavathi. We initiated Ayurvedic ideology to be coined by us to start practicing since 2015. It was great insight into the ideology.
Thank you. That is wonderful to know that there have been
the
people that have been already working on it. And Dr. Ahmed Savani, I'm sorry if I'm saying your name wrong, might have much more information to provide then.
Yes. So he has again raised a question. What Ayurvedic parameters are you able to assess through Iridology practice you are doing? Second, are you creating any records or documentation of iris of different diseases, pathophysiology like Vyadis and Samprapti through it?
So answering the first part of the question, I have been assessing the dhatus, the dosha, the agni, the koshta, the mala, the manasic status of of the individual. Along with that, of course, I'm giving a general summary. Along with that, when you've asked me if I've been creating any records or documentation in a very small scale, yes. I do have the records of all the people that I've been meeting, all the irises that I've been photographing, and all of the history and the notes. So it's in a very small scale, but yes, that is happening.
Okay. And two doctors have asked for the good reference book. If you can suggest or name something.
Okay. I don't have the names of the books here. Is it possible that I can give a list of all the books that are going to be a good read to have in any other platform or any other means?
Yes. So
Yes.
what can be done? Yes, Anna.
Sorry.
No. I just wanted to put this that Dr. Sathyavathi, you can provide those details to myself or Dr. Snehal, and we can put it in our Clinsav Gyaan Vardhini group.
Okay, perfect.
So we have many people who have joined that group, so we can share it there.
Perfect. So I will put the list of books that you can start using for reading and understanding about iridology.
Sure,
some
ma'am.
introductory books, and if there are any other notes available, I will also try and share that.
Sure, ma'am. Thank you.
Thank you.
Most of the questions have been answered. Anand, you can take over.
Yeah. Thank you, Dr. Snehal.
One more question.
Yes. Yeah.
One
please
more
go ahead.
question. Do you have utilized any software for assessing this iris?
No, I have not used any softwares for assessing the iris. Alan, although has done that and he has tested many things, and he of course believes that the human brain potential is a lot better than machine brains. So he tries to say that the human interface is much better at understanding and interpreting. So he said that they're not necessarily as precise. So it's his interpretation. So I have not explored that yet. No, sorry.
So most of Western practitioners do use it. To insight on that.
Well, I've already told you, so I don't know because I've not used much. But then some practitioners do use it, and some practitioners actually sit with very intense, machinery to look at iris and take photographs in very precise detail. And Alan often would say this, that what is the point of looking at all that many detail? You have to look at the person. The more smaller you get into, then you're losing the focus. So I would then try to, then it made sense to me, which is why I have also not tried to invest in a lot of heavy intensive machinery either.
Yes. And if possible, please explain how to assess the mental status from iris. Like we have to put in mind for prescription, like Medhya Aushadhi.
Yes. Now there are different kinds of tools that we can use for putting, like Medhya Aushadhi, I've said, but sometimes you have to also do Mansik Shodhan. So we can use Nasya, for instance, and what sort of Nasya can be necessary. But coming to the original question, um, how to assess the mental status. So when I'm looking at the iris, I am looking at the first thing that I'm looking at is the fiber structure. So when I'm looking at the fiber structure, as I mentioned earlier in one of the photographs, that when the fibers are very close together, this person is quite ambitious running. And now what happens is when this person is on the go all the time, they tend to keep running. They're very ambitious. They want to do the best of their capacities, but they're doing at the cost of utilizing what is their prana. And these people tend to collapse very easily. And that manifests as a mental breakdown. So either when you look at a person like that, they either have already gone through it or they're very close to one of it. So that, for example, is how I might understand one particular area of understanding the mind. And when this is happening, we can give specific instructions saying, okay, you have to understand that you need to stop and take more breaks. You can then understand specific medicines or herbs that you can use, or aushadhis that you can use for helping this particular individual. You can use nasyas, you can use, any other specific meditational guidances that you would like to give.
True. Good. So most of the questions been answered. Anand, you can take over from here.
Yeah, thank you, Dr. Snail. Thank you, everyone, for the active participation and engaging questions. We hope you found this session very valuable and informative. Once again, a big thanks to Dr. Sathyavathi S for sharing her expertise with us today. And thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini session, which is scheduled on 23rd of April to be conducted by Dr. Tejashree Phalerao Patil. The topic is Punaravartak Jwar. And you can also join our spam-free Gyaan Vardhini WhatsApp community group to keep getting updates on our upcoming webinars. The link has been given below, given in the chat here, and we also have our own YouTube channel. You can see all our past webinars as well over there. So thanks to everyone again, and I wish you all a very happy, a very wonderful evening. Thanks again. Thank you.
Thank you.
We'll be closing the webinar now. Thank you. Have a good evening. Have a great day.